Come in. It's time for another edition of WAJR's Ask the Expert, sponsored by HealthWorks, Rehab and Fitness. And I'm joined in studio today by Jeff Sandy. He's the clinical director of HealthWorks location in Buchanan. And our topic is the ACL. Ready? I was teasing Jeffery before we started today's show to say that, is there a ligament in our body that is more well-known than the ACL? It is the anterior cruciate ligament. It's located in our knees. We all have them, or at least we all started our lives by having them. Some of them are gone. Jeff, thanks so much for being with us. Let's, before we get into a bunch of different topics here, talk about the ACL, the anterior cruciate ligament. What role does it play in our knee, and why is it so prevalent that it gets hurt?
Yeah, so the ACL, or as you said, the anterior cruciate ligament, is one of the primary stabilizing ligaments in our knee. So whether we're pivoting, running, jumping, doing all those things, when we land or move quickly, our knee has to stabilize. And a lot of times, especially if our muscles don't act properly, we then rely on our ligaments to provide that support. So then many times, especially in sports, athletes, and it can be because they have a muscle imbalance around their knee or some other factor, but that ligament then can become disrupted. And basically saying that someone tore their ACL is a fancy way of describing a sprain of the ligament. So there's 3 different types of ligament sprains. A grade 1 sprain, just like what we commonly think of, you sprain your ankle, it gets better on its own. A grade 2 sprain, some of the fibers have begun to tear. And then finally, a grade 3 sprain of what we think of as an ACL injury, meaning the ligament has completely come apart or ruptured. So with that said, as a result, what the ACL does is it resists the bottom bone of our leg from moving forward compared to the upper bone or the femur. So when you lose that ability, a lot of times then people's knees become unstable, their knees tend to buckle, and that's where you start to have problems.
So while we may talk about the ACL the most, there's other ligaments in there. So what else is in there? The ACL is the dominant, but what else is in there?
Yeah, so there's 4 major ligaments. The ACL, then there's the PCL, or the posterior cruciate ligament, the MCL, medial cruciate ligament, and the LCL, or lateral. Medial and lateral are fancy ways of saying the inside and outside.
Yeah.
Along with that, then there are also 2 meniscus in each knee, and which help to cushion shock absorption, those type of things. And then all the muscles that attach in the area.
So there's just a ton going on there because as you said it, so we've got these big bodies, right? And we're putting stress on them, and that ligament is trying to keep that knee, supported and strong, and sometimes it goes awry. The interesting thing about this is that there have been vast improvements in correcting these issues, hasn't there? From injuries that we see today involving the ACL 40 years ago, and maybe even shorter than that, would have ended careers athletically for certain people or forced the common person to walk with a limp for the rest of their life.
Absolutely. So particularly in surgical techniques, we've come a long, long way. So there's different types of grafts. So you can have something called an autograft surgery, which is taking a piece from your own body and then grafting it on. Most commonly, that comes from one of the muscles around the knee, so the quadricep, the hamstring, or then one of the tendons. And then also there are procedures, and this is more for the everyday person, but where they use what they call a allograft, which means from a cadaver donation. So they would remove a ligament or another part from a body, a deceased body, and then use that as the supporting ligament.
All right, so you have to go back there and get that. We're going to get into a bunch of different topics here today in regard to what happens after you suffer that ACL injury. But as the clinical director at your Buchanan facility, you see people come in each and every day that injure themselves in different ways when it comes to the ACL. So what's the commonality oftentimes that leads to this kind of an injury?
Probably the most common thing that I see in my practice is weakness of the quadriceps muscle or inactivity of the quadriceps muscle. So that means that's basically the muscle, the big, large muscle in the front of your leg. It's made up of 4 different muscles. Many times, especially in female, tends to be more prevalent in female athletes. There tends to be an imbalance between the hamstrings, which are in the back, and the quads in the front, which can lead to injury. A lot of basketball players, that type of thing. But along with that, you can also have hip weakness has been a new thing, especially amongst younger people, so high school students, that type of thing, that has been found to really contribute to ACL injury. And the reason for that is your hips help to stabilize your knee and get it in the right mechanical position to do things like jumping, quick movements, those sort of things. So if you don't have appropriate activation of those muscles, it can contribute to your likelihood of being injured.
So there are ways to be proactive in helping yourself not have an ACL situation.
Definitely. And we even teach people this both as a preventive action and also as a preventive to re-injury, because unfortunately, even though they fix your ACL, they can become re-injured. So you can re-tear the same structure. So a lot of times what we'll teach people are different glute strengthening exercises. So there are different glute muscles, all move the hip in different ways, but you can, if you work on those things and also then working on your mechanics, so the way you squat, the way you jump, the way you land, that type of training can also be helpful.
All right, Jeff Sandy is with us. He is the clinical director at the Buchahnnon location of HealthWorks, and we're going to get into what if you do have the injury, then what? From a physical therapy standpoint. We'll get into that and more coming up. Do stay with us. WAJR's Ask the Expert, sponsored by HealthWorks Rehab and Fitness. We continue with more right after this here on WAJR.